a quick preview or something. There we go.
Yeah,
There.
exactly.
Great, yeah.
Yes.
Yeah, we can see that a little.
See if we can get it in this. This should be a preview, right? This is so different than I'm used to.
Page, never mind. Yeah.
View full page.
Thank you.
Yay.
You guys, I need reading glasses. Where do I want to be here? Normal page layout. I don't want that.
Customers.
I think
There
this
you
is
go.
good where you're at.
There you go.
Okay, yeah.
I like it.
Okay,
All right.
so when we approved the budget in June, we went through all of the funds with the exception of the new health fund, which is the 1161, or the local public health services fund. So I'm just gonna go through changes that were made since that time. And everybody's got an email with all these, but this way if you have any specific questions. So as you can see in the 1159, so this is our health fund, our salaries, we increased a little bit, and this is where our nurses were being paid partially from this fund and partially from our school liaison fund, and we just wanted to get all of their salaries into one fund, knowing that in the future we're going to need to move salaries into 1161. We're gonna have to decide how to balance that, and we just wanted to get all of their salaries into one fund and be able to have them paid out of one fund. So in order to do that, we moved in that $70,000, but we had to move $70,000 out. So we did that by removing medical and dental supplies from this fund and putting those all into 1161. And I'm gonna have to look at mine because I need to. So from the 24100 line under supplies, we had 70,000 for medical and dental supplies, and we moved all of that into our new public health fund plus added more. So that's how we made up for that 70,000. And then also with increasing the salaries in there, we had to increase our FICA and our PERF. And so that increase was made by removing some of the software from maintenance agreements. And again, that was made up for in the new Public Health Fund 1161. Does anybody have any questions about 1159 or even questions from before? This is the new local public health services fund. So in here, we have the salaries from the new positions that we discussed adding. So this would be our care coordinator, the grants and contracts manager, bringing the foods and environmental clerical staff from part-time to full-time, and then also the part-time food inspector to a full-time food inspector. And then again, this is the hourly, the FICA, the insurance that go along with that, and the PERF. Office supplies, these are just our general office supplies that we purchased. This is for, you know, an increase in services along with an increase in staffing. So this is additional office supplies to what we have in 1159. Uniforms and clothing, this is a shoe allowance for all of our field inspectors. So it's an amount that can be used for non-skids, for boots, steel toes or boots for environmental, and then shoes for nursing staff. Other supplies are things like anything that we would provide for the health fair as giveaways, utility services. We were looking to possibly provide some testing for retail food establishments on a private well. And then the foods department needs new Surface Pros that they use out in the field. Theirs will no longer update. So they won't accept any updates, and they're on a very old operating system, so they're about to not support any new apps. And so this is just for the covers for those Surface Pros to protect those, because they use them to take pictures, they carry them with them through inspections, things like that. Shop supplies, these are inspection supplies. There were a couple things that environmental was in need of, and then just additional shop supplies for inspections. Because of contracts, MOUs, sub-grants, we added additional for legal, because they will be helping us to review a lot more legal documentation, prepare a lot more legal documentation. Travels for the mobile unit and gas and other travel that we have to cost for that. Postage is an increase to our postage for sending out additional information for services. Also, there is a requirement in one of the core services that we can still conduct all of our vital records services in the event that we weren't able to be in the building. So that would require us to actually buy physical postage, like forever stamps, so that is included in there as well. These are our jetpacks for our Wi-Fi's for all of, we have outreach computers that go out when we give immunization clinics. We have our Surface Pros that the field staff all use when they're out doing inspections. Of course, advertising, this is, we put a lot of money in this to advertise the new services that we're offering, our outreach, all of those things. Maintenance agreements, these are things like software. This is where our hardship fund is, and so a lot of this is the hardship fund. We put in $50,000 for environmental hardship and a small amount for $5,000 for vital records and nursing, and then software that we have for some of our inspection softwares, the QRMD software that we use on the vital records or the nursing side, maintenance for the mobile unit, other rentals. We want to have a large health fair in the spring, and so this is for the rental for the facility for that. The contractual services is for language services, so that's the interpretation language service line item. Data processing equipment, these would be those new Surface Pros for the food inspection staff, along with computers for the vital records if we had to operate externally. And then this is the amount that we have left in the line item for distributions. So these would be, once we have the public health needs assessment, things that we then could put out for contract for, if there's something that somebody's doing something that we really want to help out with, that we could enter into an MOU to provide something for that. We may also reappropriate this for something that we are going to actually offer ourselves. So this is just that amount of money that we right now have set up through distributions. That's just what they suggested in the auditor's office. Does anybody have any questions about those things? All right, and then on the next page, the maintenance and trust funds. So these are the funds that the 1161 is replacing. So the only thing that we have done here, health maintenance has, so once we can use these, but once the monies are gone, then we will be closing these accounts out. So the trust fund has just a little over $40,000 in it. So the idea was to spend that down as close to zero as we can. And then the health maintenance, we made up for the amount of money, thank you, sorry about that, for what we typically appropriate in there, so that we will spend both of these. We'll still have some left in maintenance at the end of the year, but not a lot, and we will hopefully get close to zero in the trust. So the changes there from when we looked at this last time is that there's more appropriated in health maintenance, but in all the same line items, and there's less appropriated in trust in all the same line items because there was less available because there's nothing going into there this year. All right, and then everything else are just our grant funds. And these were how the funds were appropriated from the grant. So the first is the emergency preparedness grant through Johns, which we just went through last week. 8205 is our immunization grants. And these appropriations are all set when we set up the funds and when we write for and receive the grants, and we set these up through the council. Our COVID immunization grant, the testing grants. The workforce development grant is our school liaison grant. And so what we did here, so now you'll see that instead of taking 70,000 in salaries, which was 10,000 to each nursing position. We now have in one public health nurse salary in there to hire a dedicated school liaison. So that's the only change to there. And then the last two are our health initiatives and challenges lead grant and tobacco grant. Anybody have any questions?
We are also going to discuss what you're going to submit to the state also, correct?
We can.
What
It
is that?
it's the exact same information. The only thing is that it is represented differently. So the line items are different, and so the monies look a little bit different, but it's all exactly what we have listed here. The only difference is we have to give some idea how we're gonna appropriate that $808,000 for distributions. And that is not something that we have decided on yet. So right now, we just kind of have a list of things based on what we saw as the gaps and the biggest needs. But I think we were hoping to kind of tidy that up a little bit over the next week and kind of send that out to everybody for some kind of consensus before we submit it. And again, that is just, that can change at any time. That doesn't hold us to anything that we're doing. It's just them making sure that anything that we use or that we appropriate or plan to use monies in 1161 all meet those core services, and that they meet the breakdown of the 60 to 100 or the 40, up to 40%. And so again, it's kind of confusing when you look at them side by side, because it's all the exact same things that we just looked at in 1161. They just require it to be broken down differently.
Do you want to go ahead and pull up
Can.
the preliminary? So the state also, the state also was, for this initial submission, September 1st, was also fine with it really being pretty general. It didn't have to be super specific as to, we are, like, for instance, we are going to have a contract with so-and-so organization to provide specifically such and such, and it will be $48,300. They were more along the lines of, support of women in pregnancy and $40,000. Yes, so it can be really, really general in this first go-round, and then we can make changes, and we have the ability to make it more specific when we have our, community needs assessment finished and that kind of thing. So that's how they were suggesting to submit the budget to the state.
Sorry, I had to log Demetrius out because
Oh, that's right. I'm
sent
sorry.
him. No, you're fine. I just had to get into my email. And I forgot it's not the icon. It's a computer. Oh, I don't even know. Search on here.
I never use this. Oops.
No, you're fine. I just have to find that.
So the expectation with that is that it's just going to continuously change through the course of the
Yeah.
entire year.
Right.
And so next year, at September 1, they would want it to be more firm with
I
specifics?
would-
Do we even have a?
I would expect so.
Okay.
Regardless if they don't want it, if they still don't mind it being general,
Okay.
if we have the ability to make it more specific,
It just
I
seems
would
like
suggest to make it more specific.
their desire hasn't been, they haven't pushed the specificity on all of that yet, so I didn't know where that would be.
Well, I mean, when Dr. Weaver came, it sounded like she wanted us to kind of do a little bit of data collection after.
So
we
this
did-
first year, yeah.
Right, and then be able to use some of that to kind of steer us in a certain direction and what to do with the money later on.
That makes sense.
Yeah,
Yeah,
so I
I
mean,
like
I'm
that.
thinking the first couple of years, I would think they would want that to
There's
be,
gonna be a lot of collection of information.
Fluidity with,
right,
decisions
before
and
you can
choices.
really evaluate whether or not things are effective in this area.
Forming.
Yeah. So,
Right, as far as our own metrics go, so our own KPIs or whatever,
Right.
that we're making, we aren't going to see for a number of years, be able to say one way or another whether something's made a big impact. These are problems that have been in our community for a long time, and they will take a long time to undo. Yeah.
So this looks different because I have plugged some numbers in that are not, so that's why you don't see 808 here. But what they do here is they have you pull, so this is the 10% that you're allowed to save for capital. And so that comes right off the top. And then they break it down, so these are each position with their salary. And then in theirs, they have you put all of the benefits together, so this is the benefits. These are, so they have it broken down by exactly what you're using it for, so that's why all the individual numbers are different. And then these things that are highlighted are just things that were thrown in based on things that we, either things that we don't currently offer, that maybe were a core service or things, but nothing that is gonna go on to what we submit necessarily. That's just why it's highlighted, it's just filled in with options of things that we could contract to people for under professional services. And then the same down in this area where these were possibly items that we could submit for MOUs. And this is where those numbers, and that's why that number, that 700 and some thousand looks different than the 808, because I had thrown some numbers into here. But not that these are anything.
It's not set in stone.
Yes,
No.
yeah, anything that's highlighted is just all.
And again, this on the screen only reflects the 1161. Does not reflect our entire budget.
Yeah, that's true.
Okay.
So do we need a motion to approve both sets of things, or just the budget that we submit?
No, it could be both, yeah.
Would it be both? Because
I
I didn't know,
submit
because
the state by September.
despite the fact that it's a work in progress, it's something like that.
I
that we
think
approve.
we've achieved the level of specificity
Yeah.
that they're expecting from us.
Requirements.
So let's start with the one that our own county budget, if we can entertain a motion to approve the budget. Motion to approve. Anyone second? Second. All in favor? Anyone nay? And then if we can have a motion to approve the state budget that we'll be submitting also.
I'll make a motion
Second?
to approve the.
I'll second.
All in favor?
Aye.
Very good. Yeah. A lot
Now-
of
Just a
work.
few numbers.
Lot of work.
Lot
went
of
into
work,
that.
right, a lot of
Didn't
work. I'm
realize.
really
I think the
proud of
hardest
you.
thing was making sure that everything here, you know what I mean, that you were.
It's just difficult because
Yeah.
I know it's fluid but at the same time, we want it firm.
You know, something else I think, we talked about how as we go along, we're gonna learn what's working, what isn't working, what needs more attention. One of the neat things about this is we're not limited to our own experiences. We've got 92 counties that are doing exactly the same thing. And we need to stay obviously in communication with them through Sheila or however that communication will work, because we can avoid some dead ends that somebody else tried and found out that they didn't work, and we can contribute things that we found that did work. So it's neat that we've got such a big incubator here of all sorts of hopefully great ideas about how to make us a better place.
It's true.
Well, and since we have everyone here, I thought I would take the opportunity to rediscuss, our meetings, because you had informed us that some of the ones that we planned, that now there's county council meetings and commissioner meetings, so that our 9/19 and our 10/24 planning meetings won't work as we currently had decided upon. And then someone had brought it to my attention that we may be in a holding pattern until we get this data from the analysis.
Well, so that, the Pierce Group is beginning their public health needs assessment, but it's looking like it will wrap up around the very end of October. So just keeping that in mind, I didn't know how much.
What did you guys think in terms of, should we reschedule those? Should we wait till we get that analysis back?
So we know what we're looking
Because I
at.
feel like once we get that data, then we dig in, right?
We'll make it more meaningful.
Yeah.
Yeah.
And
I don't
I think
know.
there would be need to maybe have a meeting that we open up to like the community and the stakeholders with ideas. We could always do that ahead of time, so we have that going into the planning session, maybe kind of get that out of the way.
Find the date now for it.
Yeah.
Because that has been the challenge of when we have availability. And my difficulty is I don't know the county calendar.
They don't always know it themselves.
Yeah, so it changed after we made those, and
I
then it
know.
went out. I
I
sent
know,
a
I
picture
get
after
it.
box, and
From
I
my
was like,
I know.
So
Find
the
out, let me know.
only thing about that, I think that kind of meeting is a great idea. I'm wondering if we do want more of a direction though by having the needs assessment even before having that meeting. That's the only thing I'm thinking, just because then we
Help drive the conversation.
help drive the conversation, yes.
Right.
So that's possible.
More comprehensive.
Yeah.
Yeah. So I don't know, what are people's thoughts?
I agree with Gary. I think that that's the route we should go, where we have the information in front of us and we can give a more positive.
We can share it,
input.
have more knowledge, for
Right.
sure.
And I feel like that's when the work will come,
Right.
right? When we have, when we get that information,
Right.
we have to dig in and.
And then their ideas are great because they might know of things happening in another state, in another county for that specific need that maybe isn't something that we've compressed.
Is she going to present it at our actual board meeting?
That would be great.
She would like to, I think.
Yeah.
Yeah, and so when would that be? Would that be the November meeting?
Probably the November meeting, which, well, definitely I would think it would. I shouldn't speak
Even
for-
better than we did
Yeah.
it off of election day.
Yeah.
That would be, the November 14th.
Yeah.
It'll just be more information.
I think that would be fantastic if that could occur.
Yes.
So the big question was the 24th, right, of October?
Well, 9/19 and 10/24.
Oh, I see.
Both had conflicts now.
Yeah, and 9/19 is a council meeting, but then it's the first reading of all of the budgets.
Oh,
Like we have to,
Yeah.
she has to.
Yeah.
Yeah, and then our second reading is, so they have second readings on the 5th, the 10th, and the 12th. Our second reading is well, I don't know 100%, but I think it's the 10th
Of October.
of October. And then the third reading, so Evergy's final reading is October, is it 24? Sorry, I should.
Then we were starting to fall into people's, fall breaks and all that good stuff. 2017 maybe?
It was the 24th.
Was it, that's when we were gonna meet.
I had the
Yeah.
25th down.
Well, we had the 24th or the 25th.
so
I
what we're thinking then is it might make it most meaningful to have Jan Pierce come and present on the 14th of November and then the week after, because
Yeah, it starts.
2
to feel a
weeks
little
after,
wonky.
because that's Thanksgiving,
holiday.
right?
Yeah.
I know, that's what I'm
But
like.
Thanksgiving's early, so
Yeah,
maybe that week,
January.
that Tuesday after Thanksgiving, before December comes, we can have a meeting and then
Like a planning meeting.
a planning meeting, and then we have our regular meeting the week after
the
that.
fifth, yeah.
But I don't know.
I know, I feel bad, like I don't want
Uh-huh.
to make people come week after
But I think it
week.
will take more,
Yeah,
it would be best if we took more than just our monthly meeting.
100%.
Oh,
I think that there's going to be a fair amount.
Of work.
Yeah,
Okay.
to go through.
And so we save ourselves until we get that information.
Mhm.
So then that would be 10/28. I mean, sorry, 11/28.
Mhm.
And there's no conflicts on those days in terms of county meetings?
But still keep the 14th.
The 14th is our official meeting.
Right, right.
And then we scrap 9/19 and 10/24.
Oh, yeah.
Okay, okay, I just want to confirm.
Well, sounds good.
And then in December, would we just have the one meeting on the 5th? Or
You
would
know,
we
maybe
try?
as time goes forward, we can discuss more. I hate to like bog our, I don't know, I mean, I feel like our plans will change, like it's hard to know what we're gonna all be doing in December. You know, we're all willing to work together.
Will the November 2nd meeting be at 5:30 or 6? Because
The
I
Nov-
don't want to be on time.
No, no.
The November 14th will be 5:30. Our regular
December.
meetings are 5.
Are you doing
December
December
6th?
2nd?
Sorry.
December 2nd.
Harder.
I think we were trying to do some of the additional meetings at
A
like
little,
6.
yes, and our regular meetings at 5:30. Is that right?
Yeah.
Yeah.
So,
Alright.
November 28th
Hard enough to get here.
November,
would be the 6th.
yes. And then 12/5, right, is our regular meeting?
Yes.
Okay. And then we'll try to figure out something to add in December. Does that sound good,
Mhm.
if we can? I think we need to, just a
Yeah,
matter
because
of-
everything goes live on the 1st, right?
Yeah, but I mean, you know, but that's when the planning really starts. I mean, it's gonna go into the new year too, I'm sure.
Yes.
Right.
Yeah. There is a council meeting, Yasmin?
Council.
I
It's
I
the
give
time
up.
of year.
Just tell me when to come.
It's the
I
time
can't
of year.
decide on
Yeah.
one. I throw it in the air.
They might change it for all we know. They might go after that budget. I mean, that does people in right there.
I know, I mean, we shouldn't have to go, it's just if other people want to attend.
No, I agree with that. I don't want to have meetings at the same time as theirs. I think it should be done.
Yeah.
With that.
There's no meeting scheduled on the 29th, we wanted to do a Wednesday.
I am,
Those days
Yeah, I know that's
are, well,
so 11/29 at 6 p.m.
less bad. Later
That'd be
the better.
fine.
I'm free at night.
For 30 minutes before I go to bed.
No, travel stacker starts, you know.
Oh, okay.
But no, he's driving now.
So we're talking about 11/29.
So 11/29, 6 p.m.
We have a little freedom.
Okay.
So the 29th.
Correct. Until something else
Oh,
comes.
it's-
Keep your head on a swivel, because that's.
So should we just say we're not even bothering with the September 19th and the September?
I believe that's the
Okay.
consensus,
So I'm
yes.
just.
I'll go through them again. So we'll have 9/5 at 5:30, is that correct?
Mhm.
10/3 at 5:30.
Oh, I have that.
That's our regular official meeting. And then 11/14 at 5:30. 11/29 at 6. And 12/5 at 5:30. We have been trying to be organized like that.
Thank you. No, it's a good idea. Okay.
I think that's.
And half.
We'll put something out.
And I have half the council.
Depends.
All right.
If I'm wrong, you and I will be here.
Yes, well, you know.
Yeah, no, we should, it's on our, we should mention it.
Oh, yeah.
The fine help I am.
Let's do that, yeah.
That's right.
Let's do what?
Or the fine,
The fine help I am.
Yeah, speak about that.
So the last regular Board of Health meeting that we had, we were discussing Find Help IN. And Sam Burgett is a part of they just changed their name. It's the Resource Partners Network. And they were working to, they call it a white label site, our findhelp.in, or Find Help IN for our county. And basically what they have discovered is that as it is now is the free site, which is any time anybody, goes to Find Help IN, or if you call 211, or if you call 988, this is what they use to connect people with resources. So as it is with the free site, it's not extensive and it's not easy to be updated. And what we also found is you actually can't be on there unless you offer free services. And so they aren't able to, get any services on there where they take, private insurance or anything like that. And so they are hoping to white label the site, which means that it would have, it would be managed locally, and we would be able to change the different buttons for the resource types, put different resources on there, put at the top, what, is the closest geographically. Like, they would be able to hide some of those things that operate in your state or operate nationally, things that aren't going to be with resource if somebody calls in the middle of the night. Just kind of, manage all of that and be sure that every resource is represented on there. And so we had talked at the last meeting about, they found sponsorship for getting the site started. So it's $11,000 to implement it. And so they've gotten a commitment from BU and from Northwest Health, and they were $1,000 short on that implementation. And so we were talking about, we like to be able to give them that $1,000 so that that is a process that can get started with that white label site. And so then there was some discussion about who was going to maintain that going forward and kind of where that was going to be housed. And so Sam came in and gave a presentation when we had our meeting with the Pierce group, and she really explained it all well, and we were kind of inquiring about the possibility of it being our staff who would maintain this and keep it going in the form of our care coordinator, who would be the person who would make the changes and would monitor the site. And then our website would actually be kind of like the main landing page for it, although everybody can, put a link to it on their site, and allow everybody to navigate there. And so that's kind of what we discussed with Sam, and it's something that she would love to mention to the resource partners if it was something that we all would be in agreement on. So that maintenance fee so the implementation, they still have the sponsorships, and so they still are $1,000 short for the implementation. And then the maintenance per year is $9,300. And so then it would be something that, like you said, we would propose if it would be something that the board would be so inclined to do, that our care coordinator, once it's implemented, would maintain, and the health department would, maintain and keep that up so that it's always here, and if there's any staffing changes, it still kind of remains here, and that it still stays.
When did she say did she give us any idea of when she would know from talking to the group?
It is actually on their agenda for Friday.
Okay.
So it was kind of depends on, if we're happy with it or.
CPR.
Does anybody have any questions or comments about that, or?
So does that mean that we essentially just take that over?
So it would be implemented by the group. So with the sponsorships, and the group is all set to work together to implement it. And then if it's something that we would, then it would come, we would do the maintenance.
And we'd be responsible for the 9,300?
Yes. Yeah, it's something that we build into the budget each year.
It sounded like some of the people were still interested in maybe assisting it in the maintenance, but I don't think it had been really discussed because they haven't even initiated the whole program.
Yeah, that's what I was thinking.
Yeah.
Originally, when I had talked to her, I think that she thought that they had the maintenance fee, and then I don't know if she wasn't quite sure about that or where that was at when she came in and talked about it, so.
But then on the safe side, we would just put the whole thing on our budget, but we could maybe in the future, those sponsorships contribute.
Right.
I mean, or maybe we could offer them some sort of like, sponsoring, you know, like, yeah, with like saying sponsored by bottle.
Yeah, because I know that when it's implemented, that will definitely be, you know, their
I mean,
logos.
Maybe
and
they'll
things will
see
be
it
on
was
there for
worth their
sponsorship.
investment.
Correct.
Yeah.
You know, that kind of thing. But currently, we have it in our budget, they're proposed to be in our budget. so
We do. Yeah, we have enough money put into, for the software as maintenance agreements, that would cover that, if it was something that we was.
I mean, I think it's a great source that would really help the community in the aspect of, I mean, especially since right now, I mean, anything that is insurance related cannot even be listed. So that's really eliminating quite a bit of services that are available. You know, in the area and the community, so, yeah. That right there is problematic, in my opinion. And also, she was saying too, that they would be able to list the ones first that actually would be able to help in a, you know, urgent situation,
Yes.
not just somebody that you can call, but then you're not gonna be able to get.
9 to 5, yeah.
Well, some of these places have like very long wait lists,
Mhm.
or they're not, you know, helping right now.
Yeah, I thought that was nice too, that you
Yes.
could prioritize
Right.
them.
The way-
Yeah,
So,
yeah,
yeah.
some of these
Yeah.
places are overwhelmed and they're not in a position right now. Correct.
People
Right.
in
But,
all
I mean,
over.
but then they would at least know that and
That's a
not be
great
putting
idea.
those, you know, those ones first, so people are, you know, wasting their time trying to call them and then it's, you know, not going anywhere.
Exactly, when you think
Yeah.
really one message.
So we already have that included, but we wanted to discuss it further.
Yeah, I mean, we have it,
We already
we have
did
the
that.
amount
Okay.
of money appropriated if
Okay.
it so suits the, you know, if the board. for both.
I just thought it would be nice that we followed up on that because
Yeah.
that was brought up,
Yeah.
that we take it over, you know, and then they seem to be on board with that plan.
Do we need any kind of motion for the?
Well, we approved the
thousand?
budget.
You approved the budget
Yeah.
already,
Ah,
and she's explained how she intends to spend the
okay.
budget, absent some angst about that. I think it's been approved, and she's gonna proceed
Very good.
until such time as she's told not to proceed.
Thank you.
But but that's gonna happen now, that's not, right?
So they are hoping to begin the implementation. So the implementation is what is mostly sponsored. So it's
Okay.
sponsored at 10 of the 11,000. So if we are able to, you know, do the other 1,000, then they'll start with the implementation right away.
Right.
And it would be in 2024 that we would.
Right.
Yeah.
I'm just saying the 1,000 though for, I see what you're saying, because the
Yes.
1,000 for now would technically not on the budget for next year to be current, right?
Correct.
Yes.
Mhm, mhm.
So,
Did we do that last time or
We did not, no.
no? Okay. The
No, we
1,000
did
we
not.
didn't do?
right, so that's why I'm wondering if we need to
Correct.
move
Yeah.
right.
But I don't
Yeah,
remember.
no, we talked about it, we had more questions, and then that's
Yeah,
why we
that's
asked
right.
if she could come to
Yeah.
the meeting, and
Yeah.
she did, and then that we wanted to make sure too, yeah.
I know. Do we need to vote for that? For that? David's good,
We
and
do,
I'm
we
good.
have the funds.
Okay.
That-
Not the funds.
I don't want to create any more
All right.
work for anyone to do that doesn't need to happen. Very good. Anything else? Before we open up the public comment?
We did want to invite everybody, right?
Oh, yes, yes, yes,
Um,
yes.
So our Public Health Emergency Preparedness Coordinator, John Peisowitz, was here last month, and he mentioned that he just upgraded, he's also a Navy reservist, just upgraded to the rank of commander. And he was hoping to have we've arranged for him to be able to have his promotion ceremony. I mean, he already technically has been promoted, but his date of rank is hit already. But he would like his promotion ceremony at the health department. So
Oh.
we have arranged next Wednesday.
Wednesday, the 30th.
The 30th, we have a little exercise, a preparedness exercise that the whole department's gonna be involved in the morning. And then the Commissioners' Chambers has been reserved at noon for his promotion ceremony. And he wanted to make sure that you all were invited. Please join us. And then we'll be having lunch immediately afterwards, just some sandwiches and stuff down
That's very nice.
here. So please,
I'm
if
sorry,
you're
it
available,
starts-
join us.
What time does this
Noon.
start? At noon, okay.
Am I going to that in my
You don't want to come to our tabletop?
It's a meeting, I keep calling it an
Oh, it's a
exercise.
meeting.
Carrie, it's
Okay,
meeting.
meeting.
Right.
Right. Anything that has exercise involved. Exit.
Foreign concept.
Correct, yes.
Yeah.
Yeah.
You know, I'm sure John would know this, but we've got a United States Senator who's holding up military promotions.
Oh, yes, I'm sure he's, yes, that's.
Is that holding him up?
No,
I think it's
not to
state
commander. I think
Is
it's,
it state specific with that, or is it anything else?
yeah, no, I think that's a little different. It's mostly like general, like, and
high
above too, yeah. Because those all have to be, I'm not, I don't know for certain, but I believe those have to be
I don't
confirmed by
know
the
either.
Senate. Yeah.
I saw John's, he was official, the first.
He's
We
official.
got the list.
Good for him. I'm proud of them.
I deserve it.
That's amazing. All right, so on that note, we will open up to public comment. Due to the fact that this is a special meeting, our public comment is going to be limited to the items that pertain to the budget discussion that we've had. Also, we're going to put up the 3-minute timer up here because I don't like to tell people to stop. And so you can look for yourselves on the timer and know when your 3 minutes are up so that I don't have to do that. And please sign in before we speak.
I already signed in.
Good girl.
Okay, so you said it had to be due to the budget. Well,
Yeah, because it's a special meeting, so we're
no,
gonna
that's
just-
fine.
Yeah.
Okay, I'll throw in, are you budgeting anything for masks? So that kind of starts. Quick question, if the CDC recommends wearing masks, will the Porter County Health Department implement mask mandates?
So this is your open comment. We're not going to take
Oh,
your
no,
time.
no, no,
That's not a
I put it
question
into
and
the
answer.
budget, you know.
No,
so-
I know, but this is your comment.
Can you answer that, yes or no?
This is your comment.
This is a special meeting. about
Okay, I
the
understand that.
budget.
We just have a question. If it is something that is going to be asked, are you guys going to try to implement again?
I mean, but these are theoreticals that don't exist, so we will work
Thank
into
you.
reality.
Thank you. You have 2 minutes left.
Yeah.
I'll sign in afterwards. I'm Noreen Legan, and I'm here tonight. I believe it relates to the budget. I missed a little bit of the budget stuff, but I'm representing 320 Recovery. Some of you have been there and have heard of it, but it's a mental health, obviously recovery organization in Chesterton. It is the only one of its kind. I have pamphlets or booklets for all of you. Any kind of monies that this is really covers a lot about what it does, what it says, but it is helping young people who have been into the drug world, come out of that drug world, and become valuable citizens. And I think that's what we want. That's what the health department wants. That's what our country is looking for. And so I can't talk much about it. The person who could not be here tonight because of a conflict. But I would like you all to take a look at this, and in the future, I'm giving one to each one of you. In the future, I will, thank you. That's right. Amber will be here to speak for 3 minutes and any information. Any information that you may be able to, like the health department could send to her or give her, because she doesn't know, she's not informed on how to get connected with the health department, okay? But this organization is a wonderful organization. The Swan Center in Michigan City and Crown Point and people in Maryville are sending their mental health issues or recovery people on Wednesday nights to their open night. But they teach piano, they teach cooking, nutrition. They teach about how to recover somebody who has overdosed. They have open to mental health counselors and stuff like that. I lost 2 children to drugs personally, and in the Chesterton community, and if I had wished that this kind of an organization would have been there for them. This is open, and you're all invited to Wednesday night service. They have it's called their faith night. They have a meal for $8, and if you can't afford the $8, I will pay for your meal if you come. But and I'm not wealthy, but it's worth it to me to see you all show up and be there and see what then they have a band that plays Christian music, and then they have a speaker that speaks on biblical terms but addresses the issues like forgiveness or forgiving self or just getting over the 9 steps.
Thank you.
Okay?
What a great
please,
service.
please put this in your prayers, put this in your thought for an important reach out to them, please.
Thank you. Thank you.
Sorry.
I can't sign enough paper. Somebody else sign it, right? The pretty paper is purely accidental. I ran out of paper. Then I had to change the margins. Thank you.
I would.
Yeah, no, rainbow. Thank you. Okay, so I'm Deborah Silver. I didn't know that I was going to be limited to speaking about the budget. I didn't know that this was about the budget. Maybe we citizen lowly folk could be apprised ahead of time as to, like what the agenda's gonna be, or maybe the agenda could be posted ahead of time.
Yeah, we posted it.
Okay, well, I don't know where it was posted. Was it on the health department site? Okay, well, in any case, I'm not going to give this. This is 6 minutes. I'm going to ask you to put me on the agenda for September the 5th, and I will present this then. If you'll look through it very briefly, you'll see I have a bunch of links and QR codes. I'm very concerned there's a hard deadline coming up of September 30th that needs to be heeded, and maybe it's all for the good. This will give you time to look at this material, and maybe we can do something about this on September the 5th. If I could be given an extended period of time.
Thank you.
So, can I be given an extended period of time? Or how does a person get onto the agenda?
I think you've done it. You said you want to be on the September regular meeting.
Yes. So I'll be on there?
Make sure when we get her on, that she can talk for 3 minutes at the regular meeting.
No, not 3 minutes. For me to just read this is 6 minutes.
We'll read it in advance.
Okay, you're going to read all of this in advance because I've referenced well over 250.
Yeah, I'll read,
pages.
if you want, I'll read the other 3 minutes and you can read 3 minutes.
There you go.
Very collaborative.
I mean, we want to hear it too.
Yeah.
Absolutely.
I don't know what it's about.
Oh, I bet she'd give you a copy.
Okay, so this, and what this is about is that this is about the proposed amendments to the international health regulations of the World Health Organization and the UN. And there are some very hard,
I would say to stick to the purview of what we can do as a health department. I
Well,
don't know that
we
we can control
had-
anything with the World Health Organization at this.
well, we had better do something because otherwise they're going to control
We
us.
have to act within our purview. We only have so much that we can do.
So
Are you open to listen? Nope.
how do we, so there's not, they just rule over us? I mean, we have no say-so? I mean, this is we are local folk here. I mean, you know.
Sure, but each department has the things that they attest to and they have to deal with.
But these are public health issues, are they not?
If it's World Health Organization, we do not discuss matters that go on through there, that we don't influence them in any way.
Well, it gets to the business of, you know, the pandemic, of, you know, that we recently came through and the,
And they listen to us?
well, somebody's going to have to listen to us because I think that's the problem. I think that they're taking, you know, all kinds of authority from us because we think we can't say anything.
It's called We the People.
Listen, I agree, but we do have a breadth of purview that we have to follow.
Like, could you tell us what it is?
Like septics and like
Like what?
food, like septics and food issues, and we have other
Chronic
things on our
illnesses.
agenda.
But we were involved in
Maternal fetal
COVID.
health,
We're-
we have-
End of the debate.
I don't think that's what she's talking about. Do you guys know what the World Health Organization is planning? Do you guys know what they're planning? It's getting voted on the end of September, and that's why she's bringing it
Yeah,
up.
September 30th, that's why I brought it up.
I think
It
we'll
will
find
take
out
our control
after
away. You
September
guys
8th.
won't be needed if this passes, because the board won't matter, the health department won't matter. It's all gonna come top down through the World Health Organization. Throughout the world, you really need to read up on it. It will affect you.
Okay. Thank you.
Just like it has affected us and the mental health issues.
I really do hope you'll take the time because there's nobody busier
We're on
in this
your
room than I
side.
am.
We're on your side, you guys. We're on your
And, you
side.
know, I have taken dozens of hours doing this research and doing this reading, and I'm telling you, I'm a professional musician, I run my own nonprofit, I have a 30-year-old special needs daughter, I have a multi-generational family with grandchildren living in. My time is very precious,
Thank
and
you.
I have put dozens of hours into this, so I think the least you can do is, you know, look into this, it will affect you. Thank you.
Thank you.
3 minutes or 3 minutes?
What is the process to get on items on the agenda?
I couldn't hear the question.
The process to get on the agenda.
I think you've done that at this point. We've told you that at the next regular meeting of the board, this is a limited purpose meeting for the budget, that you can be on the agenda under public
Oh, you're
comment.
talking to her, okay, because you're looking at me.
Oh, I'm sorry.
That's okay.
Because it was, who asked the question? Okay.
Look, Jessica,
I'm sorry.
I mean, just for anything, for
But
anything.
Dave,
like-
just to clarify what you're saying they're asking to be an item on the
Under
agenda.
public comment.
Under public comment is the only option, right, is what you're saying?
Yeah.
Okay, because that's what they were looking for clarification on, I believe, right?
Just make sure they're listed under public comment to have 3 minutes to talk to the board about their issue. I'm sorry, Jessica.
Yeah. I'm just thinking, isn't like county council, you have to have a majority to vote that it's, or just the president makes the agenda, right? I'm just wondering how that works, just with any items.
Well, if there's a majority of the board that wants to handle it some other way, then sure. I mean, the majority of the board dictates. At this point, we've told this lady that we will put her on the agenda under public comment for 3 minutes. If that's not acceptable to a majority of the board, then the majority of the board needs to speak up and we'll have to modify what we're telling them.
I'd like to hear what she has to say beyond the 3 minutes.
Okay. Anyone else?
I'd be willing to listen. I haven't dove into any of this.
The meeting on the 5th.
I'm sorry.
At the meeting on the 5th?
Right, that's our regular meeting where we take regular things. This is a limited purpose of the budget.
I mean, we need to know what's gonna impact us at the local level too, so.
Do we need a motion in a second, roll call? Vote?
Yes.
Okay. You want me to do it?
And the issue is, how are we going to place these ladies' comments on the agenda on September 5th? Is it going to be integrated into the regular agenda as an item? Or are we going to list it under public comment with the restrictions that apply?
Sounds like an agenda item.
I'm sorry, Don.
Sounds like listing it as an agenda item.
That's what you're advocating, right?
Yes.
Okay. And what I said is that if we have a majority of the board who wants to handle it that way, then we handle it that way.
Anyone
Otherwise,
else
it's a
interested?
public comment.
Yeah, I'll make a motion to add her to the agenda for, with a time limit of 10 minutes. I think that's reasonable. That's more than what she asked for, because that'll give us an opportunity to ask questions. And if it's going to impact us here at a local level, I absolutely want to know about it. So,
Okay. We have a motion. Sounds like we have a second.
Yep.
Okay, why don't we take the roll? Chris?
Start over there, Dr. Michael.
Yes, I'd like to.
Kathy?
No, I think it belongs under public input.
Terry?
I think you can do an agenda item with that.
Okay. Jessica, I'm assuming you're involved.
yes, ma'am. Aye.
Robin?
Yes.
Yeah.
Dr. Cullen? And Dr. Thompson?
Yes.
So what's the final count?
6-1.
Okay. Then we will place, we need the contact information then. We will place this lady on the agenda as an item on our regular agenda for 10 minutes. And we'll do our homework ahead of time and read the information that you've given us. How's that sound?
Splendid, thank you very much.
You're welcome. Okay. Hearing no one else.
Oh, yeah.
Wait a minute. We're reluctant here.
Thought you were getting out of here right here.
I just have one question.
Please sign in too.
I will.
Thank you.
Okay. This was back to the March-April commission meeting. I don't know the date exactly, but I'm sure you will recall it. I was curious what the reasoning or the concern was to request a mask prophylaxis site at the Expo Center. I was curious what that was for.
Again, we're speaking regarding to our budget, because this is an extra budgetary meeting. I don't know how that was involved in our budget.
Well, does it cost anything to do it? To have the mass prophylaxis site at the Expo Center? Is that part of the budget? We pay for the planning. Okay. For it, right? No? I don't know.
Again,
Yeah. Mhm.
you always have the opportunity to come during their regular monthly meetings
Sure.
under public comment
Mhm.
and make any statements and ask any questions.
Okay.
We're trying to
I'll be here the
focus
next
this evening
On
on
the
what
budget.
the task at hand is, and that's get the budget.
Okay. That's all I have. I'll ask next time, I guess.
Thank you.
Yeah.
Thank you.
Hi, you guys. I just have a question. I think this does affect the budget because I'd like to see the vaccine, research on the vaccine. I know that we're probably spending money on the vaccine, and I know that it was all over mainstream news today that there's another booster coming out that they just invented again for the next variant. So I just wondered if you guys had a chance to look at this stuff yet. Like, because I sent you guys through email,
Oh, that
your
was after
doctor,
the last,
and,
yes,
yeah, did you guys get to look at this?
I did.
When can we find out, like, what you guys are gonna do about making sure that our county has informed consent and that we can get more information? I mean, this book is, this is all Pfizer stuff right here, and most of it's negative regarding it. it's definitely not something I would want to take into my body. And I know that a lot of people here might have already taken the vaccine. I'm not here to like judge anybody. All I mean is that, you know, if this is going to be forced on our kids and our grandkids and our husbands and our wives and everything, I really want to make sure it's safe. And I think this should be somewhere in the budget to start researching this and finding out if our health department, if our county should be pushing a mandate. Because I know that everybody's going to listen to you guys. Even if you just say it's recommended, the doctors will be, making everybody, telling everybody to get it, just like they already are. So, you know, I'm just concerned, and I know that you guys are the ones that are going to be, you know, you're going to influence what our county does. I have kids that work in this county. I don't want their employers to be told that they have to force them to get the vaccine. I mean, there's so much in here. I know this isn't the meeting for it. Maybe next time I'll just, say a few things more about it. But it's so dangerous according to Pfizer. You know, this isn't my opinion. I would really love it if you guys could buy this book and read through it. And now Moderna is, a court ordered Moderna to release their documents. So they're in the process right now of putting that together. I mean, this is frightening. So, I mean, I would like to see like informed consent, more research into the safety, especially for kids. Pregnant women, 85% death rate among fetal deaths in pregnant women who got this vaccine. In the first 90 days of the vaccine. It's in here.
That would equal to probably 1 million
Yeah, it is.
baby deaths.
You're right.
We
You're right. It's in Pfizer's documents. I would love it if you could buy it and read it yourself. There's a OBGYN that is the specialist in the United States. He's like the top OBGYN. He sees thousands of ultrasounds every month, every week, every day. And he said he's never seen anything like this. They're having stillborns like crazy at the hospitals. I mean, it's all documented. I really urge you guys to protect us through the health department. Please research this.
Thank you.
Thank you.
Hello, my name is Tim. I'd like to thank all you folks here this evening. I brought a little visual for everybody. Satire is a wonderful thing. I would suggest subscribing to the Babylon Bee. They have a lot of good stuff. But 2 Timothy 1:7 in the Bible says, "For God hath not given us the spirit of fear, but of power and of love and of a sound mind." And somewhere else it says, "Speaking the truth in love." And I love everybody. I don't care what color you are. I don't care if you're a man or woman. There's only two, by the way. There's not extra genders, sexes, whatever. You're born either male or female. But we need to get back to basics. And 3 years ago, when the pandemic started, a lot of people dropped the ball. And I don't know who all in this room was here at that time. I have no clue. But a lot of people just went along with the show, and it was terrible what was done to us. And if you want to wear a diaper on your face, that's fine, you can do that. But you shouldn't, the health board or whoever shouldn't be telling people that you have to do that. Or if you don't, then you have to shut your business down. That's wrong. If you want to wear the diaper, that's fine. If you want to get vaccinated, that's fine. It should be individual choice, individual freedom. And there was a video I saw, I think it was the Babylon Bee did it. There was a doctor in Italy, and he painted a bunch of round rocks like soccer balls. And at night, he went around, I think he had 17 soccer balls, and he went around the city and spread them all over. The next day, in his office, there were a bunch of men with a cast over their foot because the men went out the next day and they seen the soccer ball, but they were a rock. So they kicked it, they hurt their foot, they're in the doctor's office. It's a joke, but it speaks the truth. And I brought a couple masks with me tonight. Here's a good one here. or when the sun's real bright, you can wear this mask. This one here, it's like a bikini mask. It's actually an eye patch. You can wrap it around. You can, put it over your nose like that. Had bad vision one time, that's why I had to get that.
It's more like a thong.
Yeah. My favorite mask, and this one here, this one protects Ukrainian pregnant men from climate change. This is the best one right here. You can breathe the fresh, clean air. It's really good. And last but not least, I brought this laundry hamper, and I think I'm going to get the vaccine whenever I fill this bucket up with water. Thank you.
Thank you.
All right, well, motion to adjourn our meeting.
I move we adjourn.
Second, all in favor?